Okay, so how do you protect the old? When we wrote the Great Barrington Declaration in October of 2020, this was a very complicated question because the vaccine was not available. So I've highlighted and read the right strategy now. The vaccines that we have are incredibly effective at preventing severe disease among for the people that get the vaccine. Incredibly effective at reducing the likelihood of hospitalization. So the idea of focused protection with a vaccine this good is very simple. Prioritize older people for the vaccine. Make sure that every single older person and other people who have chronic conditions that put them at high risk receive priority for the vaccination and vaccinate them as quickly as possible. The equity the sort of consideration is also important. It makes no sense to vaccinate a child in a rich country when there are still many, many older people unvaccinated in poor countries. I believe it's incredibly immoral. So prioritize vaccinating the old both within and between countries. That is the basic, the simplest kind of focused protection you can do because of the incredible effectiveness of this vaccine. Now, this was written in October 2020 before the vaccines. So we had many, many other ideas that you actually might still implement in places that have not vaccinated the old. So for instance, in the United States, there were enormous mistakes made in the early days of the epidemic where infected patients were sent back to nursing homes to recuperate, spreading the disease and killing enormous numbers of people in places like New York, New Jersey, and Pennsylvania. Nursing homes turned out to be a very important locus of this disease. 40% of deaths in the United States, and I think actually, frankly, almost worldwide, are in nursing homes and care homes, places where older people live. And so one idea is and many of the diseases are now brought in not by nursing home residents who were tested, but rather by staff who work in multiple nursing homes. So the idea would be to test nursing home staff and visitors, unless they're already immune, they've recovered from COVID or immune, and then only allow them to work that day and give them leave if they're positive. Nowadays, with rapid antigen tests, this is very, very simple to do, very cheap. Minimize staff rotation in nursing homes, so make sure that nursing home workers only work in one nursing home and not multiple nursing homes. It turns out that many nursing home workers work in multiple nursing homes in many countries, and they track the disease from one nursing home to the next. Let older people work from home if that's impossible. Use funds to offer temporary retirement or sabbatical. Minimize multi-generational living. For instance, if and this is a major problem that, for instance, that happened in the United States in Los Angeles County. Many people in Los Angeles County, especially poor people, live in multi-generational homes. An older grandmother living in the same household with a young person. The resources that were used, for instance, to house homeless people temporarily during the pandemic could also be extended and offered to the older person living in the multi-generational home. When the young person goes around the community, says, "Oh, I might have run into somebody who has COVID," comes home and tells them, offer the temporary housing to the older person living in the home until the young person is test negative, and then she can come back home. Home delivery of food and necessities. Many young people actually with good jobs stayed at home during the epidemic and ordered Amazon deliveries, grocery deliveries, DoorDash, a whole series of other things, protecting young people from exposure to the virus, while older people, they went into the grocery stores to go get food. This should have been reversed. Make a policy to protect the older person so they have the food delivered to older people who are really at high risk rather than to younger people. Recommendations to meet outdoors. It's still, even though this is a bad disease, it's still quite important to get fresh air, exercise that actually protects you against diseases. Obesity turns out to be an enormous risk factor for this disease. Many other ideas. The key thing about focused protection is that it's a local phenomenon. It depends on the local resources of the people in the area. What will work in one place may not work in another place as far as these ideas for how to protect the old. And local public health has to play an incredibly important role in thinking through how these effects, what to do. With the vaccine, it's simple. Prioritize the vaccine for the old. Okay, let me show you some evidence that this worked. So first, I'll show you some evidence from Sweden. These are graphs. The top graph is the graph of cases in Sweden. Sweden, of course, did not follow a lockdown policy, followed a much more focused protection-like strategy, and it had, I'd say, mixed success. In the wave of cases that happened in the winter, you can see an enormous wave of cases in the winter, from starting in mid-October all the way through February, and they had a lot of deaths that followed. That's the bottom graph. They had a rollout of the vaccine that was actually quite slow. So by the beginning of March, they had only vaccinated about 7% of their population, which is 1/5 of what Mexico has vaccinated to date, something like that. And but they reserved every single dose for somebody living in a nursing home or older population. And they had an enormous wave of cases this spring, and yet they had almost no deaths. It's absolutely striking to see how few deaths they had, simply because they had vaccinated the old. They protected them from the severity of these diseases. So this disease outbreak did not lead to the deaths that happened during the winter wave. What about the UK? Same story. And the UK followed a lockdown strategy in the winter. It failed. An enormous wave of cases in the winter, accompanied by an enormous wave of deaths in the winter. You can see the top graph is cases, the bottom graph is deaths from COVID. In June of this year, the Delta variant started spreading rapidly through the UK, a huge wave of cases that's still ongoing in the UK. But because the UK had vaccinated such a large fraction of its old population, I think it's, in fact, the population at large, the deaths have not followed in the same way they followed in the winter. Cases and deaths are decoupled. This is what focused protection looks like. When a country has achieved focused protection, it has decoupled cases from deaths. It does not stop cases from going. That's not possible. We do not have a technology to stop cases from going. But what we do have is a technology to decouple cases from deaths. In the United States, I'll just give you the example of Florida, which followed essentially a policy much closer to Sweden. I'm calling it a free policy, whereas California, where I live, has had much more lockdowns, business closures, school closures, and so on. And what you can see is that blue is California, red is Florida. These are data from CDC through September 22nd. Florida actually had fewer deaths among the 85 and up, fewer deaths among the 75 to 84, and fewer deaths among the 65 to 74-year-olds than California did, because they followed a focused protection strategy. The deaths you can see among the young are roughly the same. Finally, Mexico. Mexico it actually started its vaccination campaign very early, December 2020, but it focused mainly on healthcare workers initially. And it wasn't until February 2021 that Mexico began the task of vaccinating millions of seniors against COVID. It sort of delayed the idea of focused protection, protecting instead older populations. The Mexican rollout has been, I'd say it's about at the world average. The world average is about 35% of the world has been vaccinated. 77 million doses divided by 2 is 35 million, because you need 2 doses for most of these vaccines. Mexico is about at the world average. That says about 35%. Well, what is that bought? Actually, it's bought quite a lot. So you can see Mexico, the huge increase in cases this winter, just like everywhere else in the Northern Hemisphere, a huge increase in deaths in that wave. But this wave this summer, also with the Delta variant, has seen an enormous increase in cases, a huge wave of cases, which thankfully is finally starting to abate. And the deaths are only a third or a half what was experienced in the winter. The vaccines have blunted but not entirely decoupled. A vigorous effort within Mexico to make sure every elderly person is vaccinated, every person with severe chronic disease is vaccinated, will entirely decouple, just as it has in the UK, just as it has in Sweden. Um, One thing about the vaccine I wanted to note, this vaccine is as I said, an incredibly effective vaccine. Here I show you a study from Qatar, which has a great system of tracking vaccinations and outcomes. What we can see is that the vaccine went after the second dose has a 95% efficacy against severe disease, including death. And 1, 2, 3, 4, 5, 6, 7 months afterwards, it stays very high, 95%. This after more than 6 weeks has such a wide confidence interval. You shouldn't be worried about this. It's still actually likely to be quite high. The vaccine protects against severe disease and death, and it does so for a long period of time. As best we can tell, at least 6 months and most likely much longer. It's a great vaccine. However, what it doesn't do is it does not stop disease transmission. So here, this is effectiveness against any infection, not against severe disease. Well, it turns out that within a month after the vaccine efficacy against any infection is only 72%. 2 months, it's at 65. 3 months, it's at 55. 4 months, it's at 29.7. And at 5 months, at 6 months, it's 0. After 5 or 6 months, the vaccine does not protect against disease transmission. It protects against severe disease, but not against severe. So this vaccine is not a tool to get to zero COVID. It will not stop the disease from spreading. And you can see the evidence of this in highly vaccinated countries like Iceland, like the UK, like the United States, that the vaccine, even though they're highly vaccinated, you're still seeing very, very, you're seeing large waves of cases despite the vaccination. The vaccine is a perfect tool for focused protection, much less good for severe disease, much less tool for zero COVID. We have no technology to stop viral spread. The implication is simple. Everyone on Earth will, at some point in their life, probably within the next few years, might even be this year, will face COVID. Everyone alive will face COVID if at some point in their life. I'll tell you, I personally was vaccinated in April of this year, 2020, and in August I had COVID. This is completely consistent with the data that I just showed you from Qatar, where by 4 months the efficacy against infection was only 30%. Okay, let me talk about the lockdown harms. Why lockdown is not the right strategy. The harms I'm going to mainly focus on are on health harms. I can talk about economic harms, but I want to focus on health harms because many times I hear an objection that we shouldn't be comparing economic harms to health harms. Health harms are more important. I agree to a large extent. So I'm going to just focus on the health harms of the lockdown. First, the lockdowns in the early days, it scared people from even seeing the doctor at all. Cancer screenings plummeted in the United States, and this is not just the United States, many, many other countries. So, for instance, in the first weeks of after the lockdown were implemented, breast cancer screenings dropped by 1/2, 50% reductions. Breast cancer screenings, 50% reductions in colorectal cancer screenings, and so on. The consequence is that many women will show up with late-stage breast cancer this year that should have been picked up and identified last year and treated when it was still in the early stage. Hemoglobin A1c levels are important for diabetics to track in order to control the consequence of diabetes. Well, the checking for hemoglobin A1c levels plummeted by more than half in the early days of the lockdown. And still, many diabetics are reluctant to go get care because of overcrowded hospital systems or fear of COVID. The COVID vaccine is not the only important vaccine. In fact, there are many, many more important vaccines than the COVID vaccine. The World Health Organization warned in the early days of the pandemic that at least 80 million children at risk of diphtheria, measles, polio would skip their vaccinations. And in fact, that's exactly what's happened. Vaccine programs around the world were stopped, and many children will now will be at higher risk of dying from diseases like diphtheria and measles than otherwise would have been. And polio, which was on the verge of eradication, has made a comeback. in South Asia, where it was where sort of the last bits of it were. The mental health effects of lockdown are probably felt by everybody in this room. Anyone that's been through this pandemic understands the anxiety that comes from not being able to live your normal life. In June of 2020, the American CDC conducted a survey. And what they found was that 1 in 4 young adults, 18 to 24-year-olds, 1 in 4 young adults, 24.7%, had seriously considered suicide in that month. The depth of psychological despair that would lead young people to consider suicide is enormous. Of course, it happened not just to young people, but young people were particularly affected by this. The surveys to date have continued. They found enormous increases in depression, enormous increases in anxiety, enormous increases in suicidality, which are real and should be taken into account. In poor countries, the virus has been linked to 10,000 child deaths each month from hunger. 10,000 child deaths. A fantastic study that was conducted in 9 different countries and published in Science Advances found that household coping strategies and government assistance were insufficient to sustain pre-crisis living standards in 9 different poor countries, resulting in widespread food insecurity, which is just another word for hunger, severe hunger, and dire economic conditions 3 months into the crisis. 100 million people around the world are at risk of starvation or worse as a consequence of the lockdowns. 100 million people. In the March of this past year, the UN reported that COVID-19 disruptions had killed 228,000 children in South Asia. 228,000. A disease that does not primarily affect children. In fact, leaves children more or less spared, COVID-19. And instead, what we've done is lockdowns that harm children. And I'm going to talk a little bit about the social inequalities, and then I'll end so I can leave time for questions. But the social distancing and the measures that many countries have adopted to address the lockdown are not equally shared. Richer parts of our population, parts of the population that have jobs that can be done by remote work, have had a much easier pandemic than poor people who cannot afford this luxury. In a sense, what we've done is we protected young members with the lockdown. We protected young members of the laptop class. And remember, who's at risk? It's not the young. It's really the older population that's at risk. Let me just show you the results of some of this. So this is an estimate. This is an estimate from Boston. The purple bars are the expected number of cases based on population in different parts of Boston, and the pink bars are the number of percent college educated. And what you can see is that as the number of people college educated goes down, the number of cases goes up. The disease spread in poorly educated parts of Boston, did not spread in the richer, well-educated parts of Boston. This same thing is true in Toronto, in Canada. This graph tracks the number of the amount of mortality in Toronto. The gray is the 30 lowest income neighborhoods. The blue is the 30 highest income neighborhoods. The lockdown protected the rich and did not protect the poor. In LA County, this is from March, but the same result. Like I just looked it up today. I should have replaced this with the most latest result, but the same result is true. As of March 2021, Hispanic areas in LA County had enormous death, 3 times the number of per capita age-adjusted deaths that had white areas of LA County. The richer area of LA County had much less mortality than the poorer areas of LA County. LA County, of course, is in California, which followed a lockdown. Florida, which did not follow a lockdown, by contrast, had much more equal outcomes by race. Because if you're free, the disease doesn't discriminate. The lockdown discriminates, but the disease does not. Florida, again, you can do a more systematic analysis of Florida versus California and New York. Here you can see that while in Florida, the percent of COVID deaths tracks closely the percent of the population. On the other hand, in California, Latinos, who make up 39% of the population, actually constitute 55% of all COVID deaths in California. In New York, which has also followed a very sharp lockdown policy, Blacks make up 14% of the population and yet 23% of the COVID deaths. Whites make up 56% of the population and make up only 40% of COVID deaths. The lockdowns discriminate, but the virus does not. The virus just discriminates based on age, but not on race. And so that's it. That's all I have to say. I think the human rights are important for workers, the poor. The elite will do what they want. They'll prosper. But I think the key thing is we have, as in public health, an obligation to everybody, rich or poor. And the lockdowns do not serve that purpose. The lockdowns harm the poor while actually, as you can see, not protecting the rich.